Yeah, happy to be here. Happy to be here for the first webinar of 2023, and thanks so much for the opportunity to connect with your folks around the province. So I'm the executive director with Caregivers Alberta. I've been in this role for about 3.5 months now, and learning about the caregiving landscape, about the challenges that caregivers face, and the support that we provide to caregivers. And I saw this as an important relationship to reach out to FCSS agencies across the province to let you know about our programs. And maybe you've had some information from us before, but I want to make sure that we have a good linkage, a good relationship. So you're aware of the programs that we offer. You're aware of how to refer people to Caregivers Alberta, people who need our programs and our services. And so we can learn a little bit about you too, and what resources you might have in your community, because our caregiver coaches are constantly looking for resources to provide to caregivers to help them connect with support locally in their community. And so really that's what I was hoping to get out of our time together today. Sort of a meet and greet. You can learn a little bit about what our programs are, how to connect with us, how to refer people to us, and we can learn a little bit about you. And at this point, I'm going to hand it over to our Director of Programs and Services, John O'Lowther, who's going to provide an overview of our programs, and then we can have an opportunity for a little Q&A after. So we'll keep that fairly informal, I think. John, if that works for you, feel free to ask a question as you need to. So thanks so much, and go ahead, John.
Good morning, everyone. Thank you so much for having us here. We're happy to be here. And like Daryl said, just excited to share a little bit about what we offer caregivers across the province and how we can essentially come alongside you and help caregivers in your communities and help supplement the programs and services maybe that you're offering caregivers in your community. I always like to start presentations just asking a few questions to the group. You don't have to necessarily come off mute to answer this, but if you would write in the chat box as you answer this question. Many people don't actually identify as a caregiver, and so that is where we are still working at a grassroots level to bring awareness to that role. And so I ask you, sitting here on this webinar today, are you supporting someone with an illness or a disability? Are you taking care of someone who is aging? Maybe you have parents or aunts and uncles or family members who are going through that natural occurring phase of life and aging and getting older and needing more support. Are you supporting someone with mental health challenges? Are you driving someone to appointments or taking them, shopping to get groceries or getting groceries for them and dropping them off? If you have said yes to any of that, you are a caregiver. And many of us who are caregiving don't often see ourselves in that role. We just sort of think it's our responsibility, it's our job as a wife or a husband or a family member or a daughter or a friend. So we want to know if you are a caregiver, and there are many across Alberta, there are over 1 million caregivers here in Alberta, who is helping support you? So I'm going to share just a quick little video as well, and it's a 30-second video that again just really brings awareness to what is this role of a caregiver. Many people think we are a healthcare organization providing like private home care. That's not what we do. We serve the caregiver.
Herjot left work to care for his wife. He gets her dressed, assists with meals, and helps her get around safely. Lately, he has felt tired and isolated. Herjot is a caregiver. Are you? Caregivers Alberta believes that caregivers need care too. Contact us at 1-877-453-5088.
So who are the caregivers in Alberta? The clients that we see and the caregivers we support are caregivers caring for spouses with dementia, still living at home with a progressive illness, They are spouses of someone living with a disease, illness, or disability. And these caregivers are unsure about balancing the future often, especially when they're dealing with a progressive illness. Caregivers are adult children of seniors. They are parents of children with disabilities. They are friends, neighbors, and family of the person who's needing that extra assistance. There are parents caring for adult children with special needs who have been in this long-term caregiving relationship. And we hear that although they are inspired by their children's resilience, they also have a lot of mixed emotions around their own resilience and their ability to carry this out. We have caregivers who are long distance, who are balancing work and balancing their own families and balancing travel back and forth to look after, aging family members. That's a struggle then to fit that complete extra role into the lives of their own work life and family life. So again, we define that caregiver as anyone who's supporting someone due to illness, disability, or aging related needs. And they're all around us. I'm going to share just a little bit research stats. We work very closely with various researchers at the University of Alberta and many other, but we do work very closely with the Research on Aging Policies and Practice group, and they have created some really lovely infographics through their website that you can check out. But just to share some of the stats of who are caregivers in Alberta, there are, as I mentioned, over 1 million caregivers in Alberta. Family caregivers are the shadow workforce. They are the backbone of our healthcare system. And we see caregivers all the time. Again, we don't always see ourselves fitting that demographic, but we don't always have to understand how caregiving affects us and the care recipient. We don't always have that understanding well. Caregivers in Alberta are right down the middle. They're 50% male, 50% female. That's a myth that most people perceive that it's mostly female who are caregivers. And it's simply not true. There's just a lot more stigma, I think, often around men reaching out for support around that role or recognizing themselves in that role. 1 in 2 caregivers are working full-time. You can see from that percentage of caregivers by age group there on the screen, 63% of caregivers are in their prime earning years. So they're, often at the peak of their career and at the top of their earning. 1 in 5 are under 30, and only 17% are actually seniors. That's another really common myth that most people, when they think about family caregivers, they think that it's all aging and older adults, when really that's only 70%. Caregivers in Alberta are caring for parents. You can see that's about half of those caregivers are caring for parents. 1 in 10 are caring for a child. 12% are caring for a spouse or a partner. 4% are caring for a sibling. And 16% aren't related to their care recipient at all. This is the group of what I like to call chosen family. Who is the neighbor or the longtime friend who's just stepping in because there's no one else to step in and help. That means, again, that 1 in 4 Albertans are assisting a family member or friend with those challenges resulting from aging, disability, or an illness, acute or chronic. There are also over more than 5.6 million employees in Canada who are also caregivers. When I mentioned previously on the previous slide that a bulk of caregivers, 64% are in their prime earning years. That's a big challenge. And we call those people double duty caregivers who are working and employed, often in a healthcare setting and in a caregiving role in their day job, and have to come home and be a caregiver at home too. Those are called our double duty caregivers in society. And they represent approximately 35% of the workforce. Caregivers are more than just the spouse, they're more than just the daughter, and they're more than just a friend. 1 in 5 of them are spending over 20 hours a week providing care. And 1 in 10 are spending 10 to 20, and 68% are spending under 10 hours a week. that effect on the actual economy, that means they're providing 619 hours of unpaid care. And if you paid for that unpaid care, that would cost $12 billion. So essentially caregivers are saving our economy $12 billion a year. There's a lot of conversation going on in our healthcare system and in our continuing care environments that's acknowledging the shift that is happening to provide aging in place, aging in the chosen place of your community. But that's also shifting some of that workload over to the family caregiver. And again, if we were actually paying them for that work, that's $12 billion. So who is supporting those Albertan caregivers? That's where we step in. That true cost and the impacts of caregiving, we see it every day. We see caregivers who are in major burnout mode. They think they're fine, they say they're fine, but eventually they're at the peak of a cliff and they fall right off. The family and friend caregiver who doesn't recognize is more susceptible to that burnout. So they need us to help recognize them in our communities and bring opportunities for support where we can. Often the focus within our healthcare system and the services that are provided are naturally on the care recipient. They're naturally on the person who is aging or who is battling that illness or living with a disability. So we have to shift that culture to identify and support the caregiver. Burnout shows up due to financial strain, grief and loss. We're gonna talk about some of that in these next few slides. Caregivers often don't want to ask for help either. They have difficulty asking for help. There's stigmas around it. There's feelings of shame, feelings of guilt. These are very common themes and emotions that we talk about in many of our caregiver groups, our support groups, and especially our program Compass for the Caregiver that I'm going to talk about a little bit later. Caregiver burnout is often a result of a strong and unrealistic dedication to making things as ideal as possible for the care recipient. People are in this role of caregiving because they care about the person they're caring for. And they're trying to help them and improve their daily quality of life, but consistently sacrificing themselves and their needs for this person. It's having that high expectation of ourselves as caregivers and sometimes high expectations of others, who are also supporting us in that role or our care recipient. We have difficulty saying no. And we sometimes feel that we are the only person in the room who really understands our care recipient and therefore can provide the care for them. It's a really common one, even when family members have home care assistants on board or respite services or, taking loved ones to day programs. It's hard to let go. It's hard for that family caregiver to let go. And so that's also a very common theme that we talk about through our coaching program, our one-on-one coaching program. We have to understand what causes that caregiver burnout and acknowledge the toll that it takes on our own health and wellness and that of our families. These are the signs of burnout: lack of energy, being frequently sick, being always tired. You see someone actually neglecting their own personal needs or their own health needs. Maybe they're discussing how their life is dominated by caregiving. Often caregivers have difficulty relaxing when help is there and available. They're uncharacteristically impatient and irritable, often in burnout mode. And they say they're feeling overwhelmed, helpless, and hopeless. Because of this, caregivers are at a higher risk for depression and anxiety and stress. 39% say, I'm feeling overwhelmed. 42% say, I feel short-tempered and irritable. 28% say, I feel somewhat or very stressed, and 19% say that their physical and emotional health is suffering, but there is an impact from this role. And stress can be incremental and it can build over time. Prolonged stress can actually suppress your immune system. We have so many caregivers who say, I get one cold and I just get over it and another one comes back and I just can't stay healthy. I just can't feel like I can stay on top of it. The important thing that we talk about is that we have to remember to make our own health as caregivers and our own health and well-being a priority in planning. And that's challenging when you're Often we're balancing other things in life, as I mentioned. 1 in 2 caregivers have this report of being fatigued. But Caregivers Alberta can help reduce the angst and emotional fatigue that caregivers are experiencing. One of the most common pieces of feedback we receive from clients is around how feeling supported by someone who understands their caregiving challenges actually makes a difference in their stress level. One client said, well, truly just connecting with someone who validated how emotionally and mentally difficult the role of the caregiver is, this helped me feel less stressed out. Feeling heard and told that the role of the caregiver is real. And the fact that it's recognized by people in this organization, when it's not often recognized by family or friends or even colleagues, I feel like I have a safe place to share and discuss how I'm feeling. And this has made all the difference. That's a testimonial from a caregiver that we support and that attends our caregiver support communities, our peer support groups. Caregivers experience physical challenge as well as a loss of sleep. They have physical impact due to lifting, due to transfers. Sometimes there's accidents that happen in the middle of that. So that physical impact on the caregiver's body is real. Doing the extra chores, the extra task is exhausting, being the only one that can run to the bank or do the grocery shopping. Walkers and wheelchairs, and sometimes that extra equipment in the home, again, can cause physical challenges. So it's very common for caregivers to have these physical challenges, and it has an increased stress on their own health and wellness. This is, again, just some stats that our friends at the University of Alberta and the RAP, Research on Aging Policies and Practice, have shared with us. Caregivers experience real financial challenges as well. 65% say they truly need some additional financial support because they are incurring extra cost. In order to cope with the demands of caregiving, often they end up reducing hours or changing positions or declining a promotion or retiring early. This results in lost wages. It affects the entire family unit. So there's some real financial barriers that exist and challenges that caregivers deal with on a daily basis. There are systemic challenges. Navigating the service system. I'm sure, many of you in local and rural FCSS service agencies hear this complaint. I just can't figure out, I'm so confused. I call this number, I call that number, and I can't get connected with anybody who can really help me. So a lot of what we do is some navigation assistance to help overcome some of these systemic challenges. We know 34% of caregivers need that additional home care or support. That means they need those additional healthcare services. 33% say they actually want that help. And 43% are saying, I need more information or advice about what my care recipient's going through, about the changes I'm seeing, about the medication or the treatment plan. I need more information and advice around the care that I'm providing in a home setting. Nearly half of all caregivers say that their relationship with their care recipient is strengthened during caregiving. So it doesn't mean the caregiver's other relationships are compromised. We often see stress on work relationships with colleagues. We see stress on marriages, when one spouse is caring for, other family members, and that takes time away from their spouse. We see stress between, parents and children, between siblings. That family conflict is an extremely common thing that pops up in the middle of caregiving. So it is, there's just a lot going on. There's a lot going on with the people who reach out to us. These relationship challenges are real. 1 in 2 spend less time with their spouse or partner, and they often end up feeling lonely or isolated. And so adjusting their perceptions of what these relationships are going to look like with their care recipient is something that we spend time talking about in our Compass for the Caregiver program, because it's a really common trend and a common need that needs discussed, and that we need further education around. Like, how do we balance this changing relationship with our care recipient? How do we balance the changing relationships with other people in our lives? And how do we balance the need to communicate better with those healthcare professionals and other supplementary services going on in the background. Caregivers Alberta, I'm going to talk a little bit about what is our mission, what is our vision, what are our strategic directions, and how is that really informing what we are offering as programs and services. Our mission is to empower caregivers and promote their well-being. I mentioned that most services offered through the healthcare system or even in supplementary services at the community level, they're often around the care recipient needs. We exist solely for the caregiver needs and to empower them in that role and promote their own health and wellness so that they don't become the next care recipient in the healthcare system that's needing care. We truly envision an Alberta where caregivers are valued, respected, and supported. Daryl and I, we will be attending some meetings tomorrow, I think, with the Alberta Association of Gerontology, and our organization gets to present and talk about how are we as an organization valuing caregivers, and how can we as a society here in the province of Alberta, how can we change culture to value caregivers and the work that they are doing. We were founded in 2001 by caregivers who identified a need for supports that would focus on their personal needs. It was a group of individuals who randomly happened to find each other and recognized that they felt very alone. So for Alberta to be noticed as a province where caregivers are valued, respected, and supported, it does require closer working relationships across sectors of health, government, private, public, and community-based services. And Daryl mentioned at the top of this meeting today that, you know, it is our goal to form stronger relationships with you and those of you on this call so that we can better serve, better discover, better find, and offer supports to caregivers all across the province of Alberta. We support caregivers through the development of programs and delivery of programs and services that address their needs. We use research, to inform what we're developing. We use feedback from caregivers themselves to say, this is what's going on in my life. This is what I need. This is what would really help me most. And all of that information develops and supports our creation of what we're offering through caregiver support services. We seek to develop those partnerships and collaborate with nonprofit organizations. I just mentioned this, government agencies, private sectors. We all have a hand in providing support services to caregivers. So how can we work better together to succeed in that goal? Daryl works with a variety of government groups and government officials to influence public policy to try and ensure that the health and social systems recognize, include, and support caregivers. And we do seek to develop the organizational and leadership capacity to effectively advocate and advance the needs for caregivers. We offer services directly for the caregiver, but we offer educational programs for other agencies and organizations and professionals as well, in order to look at how can you incorporate and implement services for caregivers and advance meeting their needs in your local community. We say that caregiver experiences and stories inform our work, and we feel like it's our job to raise the profile of and public support for caregivers through advocacy. So we strive to be those thought leaders and champions for caregiver recognition, and develop that organizational capacity to advocate for those needs of caregivers. I'll give you a snapshot of what we have developed and what we are delivering around programs and services. The main core service that this organization has always provided has been a province-wide caregiver support line. This is not a crisis line. This is a support line where caregivers can call typical business hours, Monday through Friday, 9 to 5, and talk to someone on the other end of the phone who understands where they're at. They themselves are caregivers. The majority of our staff, 99%. I think we have one staff member who would not claim to be a caregiver. But it's interesting when you stop and look at and think about the people that you're supporting in your life, that you probably are a caregiver. So that support line is the first piece. That was the founding service that the organization was created to offer. We offer caregiver support communities, which are peer support groups. We have offered them in person in our Edmonton office. Edmonton is the only place we have a physical location. And we have offered in the past in-person groups. When COVID hit, of course, all of us had to learn how to pivot and offer virtual services. And we were already sort of testing the waters in that area and exploring services in that area. It has been phenomenal, the number of caregivers we have been able to reach through virtual service delivery. And COVID was a blessing in disguise for us in that sense, because all of us had no choice but to attempt to access services in that way, and experience that it could still be a very powerful support system. So we have our caregiver support communities now are exclusively virtual. We have 4 different ones running throughout the week, and to try and meet the different access points and offer those opportunities for caregivers, whether it's daytime, whether it's evening. We have a men's specific group called Men's Den that's ran by one of our male staff members who's also a caregiver. So these caregiver support communities, I would say, are another extreme core service, and it's meeting a very big need for caregivers, and reducing that feeling of isolation and loneliness, because they're feeling heard by others who get it and who know where they're at. We developed a caregiver coaching program starting in 2021 was when we started piloting it. So now we are not quite 2 years in, but it has been a wild success. And so that is the program that is sort of one step up from just calling our general support line or emailing our general support line. Caregiver coaching is a one-on-one service. So if after talking to a member of our support staff, which are our caregiver coaches, about what's going on and what the needs are, or what the challenges the caregiver is experiencing, if it seems like they would benefit or want to receive that one-on-one service, then they schedule an appointment with a caregiver coach and they enter our caregiver coaching program. Many clients are experiencing that like 1 time, 2 times, 3 times, 5 times. We don't put a box around how many times they're allowed to access that service. The goal of that service is to make an impact in the caregiver lives. And so the caregiver identifies those areas of challenge, and the coach works with them to make changes in those areas. We offer education sessions, not just for the caregivers again, but for professionals and others in community. We just did one recently on legal matters, on what are some of those needs around legal decisions that caregivers need to think about. We have our Compass for the Caregiver program, which I mentioned. And we, again, strive very hard to work in this area of policy and advocacy. So we're providing those group and one-on-one supports that help caregivers connect with others, navigate the system, and look after themselves while providing care. We are trying to enhance family caregivers' skills and abilities through education and support. We're attempting to increase communities' capacity to support caregivers through education programs. This is just a quick description and glimpse of, again, what is that caregiver coaching program? That one-to-one support is a free service. Our staff working in that program have social work and healthcare and psychology backgrounds. They are that one-to-one listening ear. They help with navigating the system. They extend to referrals and resources and support. But the main goal that our coaching program has is to empower towards self-care and to help prevent caregiver burnout. Our caregiver support community, this is facilitated peer support by a member of our staff. They are weekly small group sessions where you can connect with caregivers and give and receive support. There's something wonderful about being able to talk with other caregivers and also give your support to them when you hear about what they're going through. It also validates your own experience in your journey. And then we talk about tools and strategies to manage the ups and downs of caregiving in those groups. This is an example of some of the different types of education sessions we offer. Again, these are always in a virtual environment. They were in person. We have done them in person and we still can do them in person, but the bulk of them are virtual because it allows us to reach more people. And they have been wildly successful. It's good to see the engagement and the involvement. It's very similar to this. We do a 45-minute presentation, often with guest speakers, and then we have a Q&A afterwards, like 15 minutes of Q&A. And so that's the format. And these are some of the topics and things that we address. I've mentioned our compass for the caregiver program. It is a supportive 4-week workshop that covers these areas. This is one of the most longest standing programs outside of the support line that the organization has been offering. We've been offering this program for almost 15 years now. We offer it through our own in-house programs, and we offer it through strategic partner relationships. And so I think this is an area of opportunity where Caregivers Alberta can really offer a supplemental service and a program that you can offer caregivers in your area. And so talking about how we could possibly be partners around this program. And Daryl might have some more to say about that when, at the close of this presentation, and he'll chat a little more about that. But you can find out more about the programs and services we offer, all of them, on our website. There's a news and events tab. And then we also post everything on Eventbrite. So we have an Eventbrite page that would it would show you the registration options for signing up for anything. But this Compass course is a 4-week workshop. It is provided virtually, it is provided in person. It just depends on where it's being offered, and it hits these 4 areas. There is a participant workbook that comes with it. And so there's also a registration fee that is attached to that because we mail participant workbooks out. And if you're a partner agency, we mail the content to you and the materials and supplies to you for the caregivers. These are actual quotes. It's positive feedback from previous Compass participants. They say, with Compass, I felt heard and understood. I learned that I have choices and can say no without feeling guilty. And that having someone to help was the difference between coping and crashing. What can you do for caregivers? Acknowledge them as part of the care team. Every little bit helps. So when you come across someone who is caring for someone due to illness, disability, or aging-related needs, and you're seeing signs of those burnout that we talked about earlier, maybe you're seeing that fatigue, you're literally seeing the stress on their face, what can you do to step in and help? Obviously, you can refer to our organization and our services, but there are things that you can do right then and there in that moment too, by just acknowledging their role and what they're going through, addressing their experience, helping them recognize their stress. We don't reach out for assistance until we recognize there's a need. So caregivers sometimes need some help, and they need some nudging to recognize their stress and to honor their role and acknowledge it. So helping watch for those signs of burnout, providing referrals to programs and resources, even, not just us, but there are lots of community-based service programs, many that you all are more than likely offering. So how can you work with them through those services to support them in that role? And last, but certainly not least, encourage them to find things that bring them joy in their life. We find that little discussion is how we close all of our caregiver support groups and often our education sessions, which is, what are you going to do this week to bring you joy? Because the caregiving role is not something you step out of. You're often in it because you have that love, that genuine love and concern and care. But we need to recognize, how can we bring that joy to our own life? How can we pay attention to our own health and wellness? And giving the caregiver permission to do that is a big piece of that support that they need. We have created a contactless referral process. We work directly with many agencies to actually build an established referral pathway where you fill this form out, it comes to us, our staff reach out to the person you've recommended that has given permission for us to reach out to them. And then we can follow back up with you after that and say, this is what happened. They were receptive, they weren't receptive. This is the services, we talk to them about. Yes, they accessed our coaching program. Maybe they joined a peer support group. So we can establish a more formal referral pathway, and also just a very informal way. You can go to our website. There's a refer a caregiver tab, and just enter the person's name and contact information, phone and email, and check a box that says, yes, this person gave me permission to share their name and contact information with you. And we follow up. We have found that's a helpful step for caregivers because they're often overwhelmed, and they feel like they don't have the time to reach out for help themselves. So that can be a really important step in finding the support they need when you say, hey, have you heard about Caregivers Alberta? And if you haven't, do you mind if I share your name and number with them? And they'll reach out to you because I think that you could benefit from some of the services and programs that they're offering. So that's another way that we can partner with you to make sure that we're finding, discovering, and serving caregivers across Alberta. Caregiving truly does impact us all. A client in our coaching services has said, Caregivers Alberta services have been supportive and empowering, and I'm not sure what I would do without their support. This program I mentioned is a newer program that we have in our offerings, and it has just become so vitally important. Caregivers throughout COVID, really, COVID just expanded, upon it just laid bare what was already happening in the space of caregiving, which is they're feeling overwhelmed, they're feeling stressed out, and they need more help and support. And so this program has been very influential in providing that sense of validation and discovering ways to manage stress and what are some of the action steps we can take to make some changes for our own health and wellness in our life. So that's a little bit just about who we are, what we do, how we can partner with you. So this is our contact information. Please help caregivers find us. And on behalf of our organization and the over 1 million family caregivers in Alberta, thanks for having us here today. Thank you very much. And I'm going to toss it over to Daryl and let him open a Q&A and hear from you guys. You're welcome to come off mute. Come on camera, just put your thing in the chat, whatever you're comfortable with.
Thank you, Jonah. Great job, by the way. Just a couple things that I want to mention. Dialogue with caregivers and the caregiving community is extremely important to me. I've been in this role as ED for about 3.5 months. Came from the Multiple Sclerosis Society of Canada, where I was for about 15 years. And I live and breathe that expression that we've all heard, nothing about us without us. I was at a mini conference just before Christmas, and I was sitting having lunch with somebody who I respect greatly as a thought leader in the caregiving community. And this person turned to me and asked me, well, what's your vision for Caregivers Alberta? And I thought, I don't even have the right to have a vision yet. I have some woolly ideas that are taking shape in my head, but I haven't heard from the people we're here to serve. I haven't heard from caregivers. So I don't know what the lived experience is like. I don't have a deep enough understanding in that realm. And so to address that, we made some tiny baby steps so far. We had a Meet the ED event last week, and followed that up with a couple roundtable discussions just yesterday, which were extremely beneficial and informative for me. A couple issues that came through loud and clear in terms of challenges that caregivers are facing. Income security is a big issue. System navigation. People are overwhelmed with trying to navigate the system. They just do not know where to turn. And so we want to help people address those things and bring some well-being to their lives as far as that goes, and help them to help their care recipient age in their place of choice. So these are some important issues for us. Just briefly want to go over a couple things that we're focusing on this year. One, we need to build a Caregivers Alberta ambassador program. We currently do not have a volunteer program. We implemented an ambassador program when I was at the MS Society, and it was very successful. So that's going to be a goal for us this year, is to start a Caregivers Alberta ambassador program. If you're interested in that, reach out to us, because we need to create more awareness around the entire province about Caregivers Alberta, and what we're how we can help caregivers. We want to reach out to healthcare professionals who work in continuing care facilities, who have high touch points with caregivers, because we can provide excellent education based on evidence-based research from the University of Alberta that will help our healthcare professionals see caregivers as partners in care, and intentionally and purposefully engage caregivers in that process of providing better outcomes for the care recipient. So those are one other thing I'll mention. We, and I think we've picked up on that as a theme in this little talk, is building community connections. We need to create referral pathways in communities across the province so people know who we are, how to refer people to us, etc. So those are some of the issues that we have going on, some of the things that we want to try and accomplish. I'm just going to finish by talking a little bit about the Compass for the Caregiver program. It's an intensive 4-session program that helps caregivers do a deep dive into managing their resilience, managing overwhelm, managing fatigue, and helping them to take care of themselves. We have a number of partnerships with communities and organizations around the province, and even outside of Alberta. Blue Cross Saskatchewan has reached out to us because they're interested in Compass for the Caregiver for their communities and the people they serve. So I'd like to suggest to you and ask you that if you do have some small amount of funding in your community and would like to partner with us to train you to deliver Compass for the Caregiver, we would be very honored and privileged to have a conversation with you about that program, because we think it makes a difference in communities. We know caregivers, the switch of caregiving doesn't turn off and on at will. We're caregivers at work, and the data shows that in the workplace, caregivers are often having to take time off work. There's increased absenteeism, a loss of productivity, and it's affecting not just their lives at home, their lives at work, and it's affecting our economy as well. So if you want to think about that and reach out to either Jana or me to have a further conversation. If you just want to continue a dialogue and be aware of what we have going on, we'd love to have some regular communication with you and keep you apprised of what we're doing, the progress we're making. Please reach out. And I think, Melissa, that is all I wanted to say, so we can open it up to any questions that people might have.
Excellent presentation. Are there any questions? I know someone had their hand up before, but maybe your question was answered.
Hello. I was just curious. So I'm from Lloydminster FCSS. So you said that you do referrals. Do you do it all the way out to Lloydminster? How do you keep everything updated so you can refer out beyond the Calgary border?
Yeah, Jana, do you want to take that?
Sure thing. Yeah, no, that's challenging, right? Because our mandate is to serve the entire province of Alberta. And so we consider it our mission and our job and our responsibility to be aware of what are those resources. So we actually have a very giant a data repository that list what are, the FCS office locations, for example, all over Alberta. But what are some of those tiny little services, large services available all across Alberta? So we have done a large an environmental scan and have broke it down into each zone of the province. And we are about to build the capacity into our website where you as a professional or an agency, or whether you are an individual caregiver, could go to our website and actually search that giant database. So how do we make sure we're serving the people in Lloydminster and not just Calgary or Edmonton? We have intentionally scattered staff across the province. We have staff in each health zone of Alberta. The only zone we don't have direct staff living in that zone is the North Zone. And we're still attempting to discover, the right person in that zone who could join our team. Interestingly enough, I think it was January of 2021, Caregivers Alberta did a presentation for the city of Lloydminster, which was, I think, 7 or 8 different series, education topics on caregiver needs and challenges specific to dementia. So that's an example of how we partner with a very specific area in the province. And we tailored that education series to what the city of Lloydminster, the contact from there that had reached out to us, we tailored that education to what they were hearing in the community of what the challenges were for caregivers in Lloydminster. So we do that as well. Does that answer your question, Amber?
Yes, I remember coordinating with you with the webinars, and they were.
And I recognize your name.
Yeah. Yeah, you betcha.
Yeah. There's a question in the chat that says, do we offer any grief support for caregivers with a recent loss? We do, actually. We just closed a grief and loss program that we just had in the fall. That was like an 8-week program. That's something that we will put back out again. And so we do offer some tailored programming in that area. We also have a lot of partners who offer tailored programming in that area. And again, we find it our mission to keep discovering new partners who offer all kinds of different services specific to illness, disease, or challenge of what's going on in the caregiver life. So, yeah.
Excellent. Any other questions? You can unmute yourself, type it in the chat, whatever you're comfortable with.
I see Brenda Parsons on here too. I know her too. She's been through our Compass facilitator training. She's one of our facilitators. Thank you, Brenda.
All right, I'm not seeing anything come in the chat. If you're typing furiously, I'll give it one more minute, but otherwise, I really appreciate this presentation. There's so much really interesting information in here and really actually mind-blowing information. So thank you for joining us today. And we will share the recording, and we can share your contact information too when we send out the link to the recording. So I'm not seeing anything, so sorry.
I will share with you, Melissa, the presentation, like in PDF form, so you're welcome to send that out. And I'm also going to share with you a flyer that can be redistributed to caregivers anywhere. So I will share both of those resources with you, and you can share with this group and outside this group.
Excellent, thank you. That's great. Well, thank you so much, Daryl and Jonna. Thank you, everyone. Have a great day. I don't know, the sun's not shining here yet. Looking forward to that sunshine coming out someday, but great. Thank you, everyone. Take care.
Bye.
Everybody, bye-bye.